Do you remember what it was like to be a child? Maybe you can recall your safe home filled with love, where you experienced life off the grid from the realities of the world. But imagine if you were a child who wasn't afforded that basic privilege. For many children, their childhood experience is removed from the idea of safety and instead filled with health issues, mental strain, trauma, and a disrupted education as a result of being brought from offshore processing on Nauru. A new study, recently published in the BMJ's Archives of Disease in Childhood, looked into how this displaced childhood was impacting the health and well-being of these 62 children and young people. The results were shocking. Nearly 9 in 10 children brought from offshore processing on Nauru to Australia were suffering from physical health conditions, one of which was malnutrition at 24%. Even more alarmingly, 45% of these children reported symptoms related to suicidal ideation, a suicide attempt, or self-harm. Mental health conditions were formally diagnosed in 44% of the study sample. Moreover, 94% were exposed to one adverse childhood experience in their lifetime. But why were these children detained in the first place? Under current Australian government policy, these children, as well as adults, are subject to indefinite offshore detention if they are arriving in the country by boat seeking asylum. For some, this detainment has amounted to more than 4 years. Organizations like Doctors Without Borders and some psychiatrists have reported on how the conditions on Nauru amount to an experience that is inherently toxic and akin to torture. All too often, the exposure of these children to such perilous circumstances has been highlighted by collections of incident reports, like the Nauru Files. Those revealed stories of systemic sexual and physical abuse of children and widespread self-harm and suicide attempts. The lead author of the BMJ's study, Dr. Lahiru Amarasina, a pediatrician and PhD student at the School of Women's and Children's Health at UNSW, commented that the research adds to the evidence that immigration detention is a harmful practice for children. But, sadly, this practice may continue, as the policy of offshore processing and indefinite mandatory detention is still in effect. Those unfortunate enough to come in contact with the policy will suffer greatly, just as those 62 children did, decimating their current and future health. We need to understand and undo what is occurring, uncovering a more thoughtful and compassionate approach to those who come seeking asylum. Our children deserve the right to live without fear, and growing up in a safe and supportive home as we all did.